To health insurers for requesting steep rate hikes. Legislators and customers giving carriers an earful about it this week. A third-party candidate making the race for governor more interesting this year. And help for desperate parents seeking child care could be on the way. This is Connecticut Power and Politics. We thank you so much for joining us here on Power and Politics. I'm Eric Lance Crunner. News 12 was at the state capitol this week, where health insurers were on the hot seat. Carriers asking to raise rates by 20% on average next year. News 12 Connecticut's John Craven says the hearing got heated.
As inflation hits historic highs, health insurers want double-digit rate hikes. Customers said carriers don't need the money.
$137 million in just salaries of the CEOs? Come on. Seriously?
For individual coverage, Connecticut wants an average 25% increase. For small business plans, Cigna is asking for 20% more. United Healthcare, 14%. Even Governor Lamont was stunned.
It was certainly a lot more than anybody had anticipated. Certainly much more than they've asked for over the last few years as well.
Connecticut says it lost $65 million last year because premiums just aren't keeping up with demand.
We have not requested any more than we absolutely need in order to remain part of the exchange.
2 years after COVID started, insurers say more people are going to the doctor, including mental health treatment. Also driving up cost, hospitals and drug makers keep raising prices, plus state mandates for screenings and insulin costs.
While we may have among the higher proposed increases, we continue to have among the lowest actual out-of-pocket premium cost when all is said and done.
But critics say insurers are inflating their cost projections.
Outside of this room is real life. And in real life, Connecticut families are suffering.
The state attorney general asked both insurers if they look at whether their customers can afford rate hikes. Both said no. In the newsroom, John Craven, News 12, Connecticut.
Attorney General Tong hitting it on the head right there. Next month, the state insurance department will decide what, if any, increase carriers will get. And joining me now to discuss the rate hike requests, Republican State Senator Sen Hwang and Democratic State Senator Matt Lesser. Gentlemen, thank you so much for joining us. Such an important topic to discuss.
Thanks for having me on.
Absolutely.
All right. So listen, health insurance companies wield a whole lot of influence here in the state, in part because of how many people they employ here. But I mean, come on, 20 or 25% rate increase is beyond chutzpah in this situation. Senator Lesser, let's start with you. The insurance department held its meeting this past week. We just showed everybody some segments, some clips of that. Insurers did get an earful. Do you expect them to get anywhere near what they're asking?
Oh, I sure hope not. I hope that the insurance department rejects the increases. Look, you called it chutzpah, and it absolutely is. These companies that are reporting record profits, that are, in one case, paying their CEO $91 million and doing multi-billion-dollar stock buybacks, saying, oh, no, we can't afford to do anything other than jack up rates on small businesses and families. It's unconscionable and unjustifiable.
Senator Hwang, let's get you to weigh in here because, listen, Connecticut, we just heard, requesting a roughly 25% increase. Our president said this week that we have not requested any more than we absolutely need in order to remain part of the exchange. But do you believe personally that 25% is absolutely what they need?
Absolutely not. I think the challenge is what is real life all about, and the affordability factor, and for me, the lack of respect and transparency. I said it quite simply. It seems that the insurers are tone deaf to the real needs and the challenges of people caused by inflation, caused by COVID economics. People are having to choose between food and mortgages, between having their health insurance. It really is a tone deaf. And as mentioned earlier, the fact that you have record earnings and paying your CEO such a high salary, it seems that these insurance companies are much more interested in Wall Street rather than people on Main Street.
You know, it's interesting. What I find, I think, most thought-provoking here and interesting, Senator Lesser, is that there's so much finger-pointing about why insurers do need to raise rates. Some of the critics are blaming hospitals for raising costs, yet many doctors and hospitals will then in turn argue that they have no choice but to raise costs because they're being reimbursed less from insurers. So, I mean, who's really to blame?
Well, look, there's plenty of blame to go around, and certainly we've come used to higher prices for all sorts of things over the last few months. But what I would say is that the increases requested by insurers today are much higher than overall inflation, and including in medical inflation. And so there's really a lot of questions about is there anything underlying this other than pure greed? But going back to finger pointing, I think it's important. Democrats just a few months ago, we were working to try to give consumers more choices, particularly small businesses, by giving people a public option. And Republicans joined with the insurance companies to block that. And to now say, oh my goodness, we're surprised that consumers don't have enough choices, when we had the opportunity just a few months ago to change that, I think is really something. And I think, the question that the voters got to have is who do you trust, and who do you think is going to really be fighting for the interests of small businesses and consumers who are really without affordable options right now? Senator
Hwang, I'd like to get you to respond to that.
Well, I think the first and foremost is the lack of affordability and the excessive high cost of health care in general. We have to look at the entire ecosystem: hospitals, physicians, tort reform, pharmaceutical drugs. But to simply say that there's a magic solution, that the public option, quote, government-run systems are going to be the solution is a panacea leading to falsehood. What I mean by that is government should not be in the business of running operations. We have seen the public option come out and suffer losses just like these insurance companies. What I'm looking for is real market solutions, to be able to look at benchmarking, which has been done by many other states in this country, utilizing insurance practices of reinsurance, really buckling down and looking at prescription drug costs. It's not looking for government to be the solution, but to leverage and partner with insurers, with the best market practices to do that. But it's the entire ecosystem of healthcare. People don't truly understand the cost of healthcare. And that's the crux of my frustration with these insurance requests right now. The hearing that we just had did not afford expert witnesses and rebuttal and challenges to the veracity and the transparency of the data that's being provided by the insurers. It's very similar to where utility companies were presenting to the agency, in this case, the insurance department. They make the decision without truly an exchange and a real openness of information. That's the frustration. Is I wanted to challenge them in regards to the claims that they made to these rises that they need. And for me, it was unsatisfactory. And it is, again, unaffordable, but a disrespect to the consumer that have to make hard economic choices because they're not getting all the information. A true lack of transparency.
Senator Lesser, listen, I mean, historically, I know you both agree that 25% rate hikes is just unacceptable. So there's not a whole lot of daylight in between you on both sides on this. But there still is quite a bit of daylight when it comes to the best way to reduce healthcare costs. So, I mean, how do you reduce that gap?
Well, look, I agree with Tony that we need to strengthen the rate review process. But look, this is simpler than that. Republicans have been making excuses for insurance companies for years. They are defending the status quo. And when I tell you, when I go out in my district, when I listen to small businesses, they can't afford the status quo. It's just simply not an option. And protecting these guys from competition, from affordable alternatives, I think is really unjustifiable. We are beyond due for a public option, and we need affordable care overall. I will say one good piece of news that I would like to highlight is that the Inflation Reduction Act, which just passed Congress and was signed by the president, will extend subsidies for individual plans for another 3 years. And that's going to help people who purchase individual coverage. But there's an awful lot more we can do, particularly to help small businesses on the state level. And that's something that I would hope that Senator Hwang and his Republican colleagues would finally warm up to, because enough is enough. People can't afford the kind of increases that we've been seeing.
I'm glad you brought up the subsidies, because this was one of the reasons that was being used, or the fear that these subsidies wouldn't be extended. That was one of the reasons or justifications for raising rates as much as they are. So now the Inflation Reduction Act is going to extend those subsidies. So, I mean, how do you justify that if you're an insurance carrier? How do you think this will figure in now to the insurance department's decision, Senator Hwang?
I think that's my point of a lack of transparency and a lack of true exchange of information. We weren't able to have that answer, and along with many other questions that I had in regards, they cited COVID as one of the big factors in regards to cost. But I said it seems to be ironic, the fact that there were less claims during the COVID period, and at the same time, there were millions, if not billions of dollars of federal subsidy into healthcare. So what was the rationale? So again, we didn't have the information, but I will say another thing that's a point of frustration. I didn't want to get into politics and divisiveness, but the reality is that the Democrats have run the majority of the clinics, of the Senate committees. The reality is they dictate decisions. What was not been done is because their lack of leadership in being able to create solutions. I'm hoping that we put aside political partisanship and name labeling and get to the solutions. And for me, it is a collaboration with pre-existing business markets, best practices, world-recognized best practices, and be able to collaborate. And I'm happy to report that the governor even agreed with the Republicans in the areas of benchmarking, in the area of prescription drugs, and a fully understanding that reinsurance is a product. So from a Republican side, I can tell you this, Eric, It wasn't about partisanship. It's about finding solutions. But unfortunately, we don't commit. We don't control the committee process. So for my colleagues to say, Democrats and Republicans, look who's in power,
Senator
and
Hwang?
take a look at the solutions that have been provided. Even the governor, a Democratic
Senator
governor,
Hwang.
recognized the challenges that we provided. As
I
Senator.
apologize. I do have to cut you both off. A really healthy exchange. Thank you so much for joining us. Appreciate your time. We're back in just 3 minutes right here on Power and Politics.